Joining us this morning is Joseph Mead. He is the CEO of Careline Health Group Hospice, in-home hospice care. Joseph, how has Careline Hospice prepared for and adapted to the many challenges of COVID-19 for your frontline healthcare workers?
Deb, thank you, and thank you for that question. It's really the number one thing that we focus on, and our job is to make sure that our patients are safe, and to do that, we have to make sure that our front line is safe. And some of the things that we do are simple, some are advanced, and some are just simply human. The simple things that we do, securing PPE, we've had to be creative, we've had to work very hard at making sure our staff have the equipment that's appropriate to keep them safe, to keep our patients safe. That's been challenging throughout COVID-19, but we've been able to do that. We've never had a shortage. We've actually been able to secure PPE for facilities that we work with and just been helping our community in every way we can. Some of the advanced things are education, really, and we've had to retool some of the blocking and tackling of infection control to address the pandemic and how we do that in a patient's home, how we do that in an assisted living facility. You have to really think through each of those components and provide that education, not just to your staff, but to your families as well. And then the human things, it takes a mental toll. COVID has been taking a mental toll on everybody, and the front line's not immune from that. They're actually on the front line. And so we reach out, we call, our entire team is there to support our front line and make sure that the community's behind them as well. And so the human thing of picking up the phone and asking people how they're doing is really helped bring us closer together.
Yeah, that is tremendous. People want to know that they're supportive and that they're supported and that their employer cares about the work that they're doing and cares about their well-being. So it goes so far with somebody. So now, given the challenges, how has the care for your team provides changed?
Yeah, and we acknowledged early on that people's underlying disease, that doesn't stop because there's a pandemic. And so we've had to really hunker down and focus and make sure that we're still providing the support and the care for patients that are at the end of life. And that's the most important thing that we can do. And so we've communicated, families can't get in to see each other, being able to enable telehealth visits. There's nothing that shows your heart more than taking the extra time to allow a family to connect, even if it's virtually. We've done a lot of that, and we've helped educate families on safe distancing and make sure that we get people in when they are able to get in and assist in those end-of-life visits.
Yeah, it's so important. And as you said, people are still dying of the things they were dying of before the pandemic, and to have care for them to help usher them from this world to the next, to help hold their hand from this world to the next is profound. Thank you, Joseph, CEO of Careline Health Group Hospice Care, in-home and in-facility care. Thank you for the work that you do.